Welcome everyone to today's HSPN webinar. For those who had just logged in and got bounced back out, greatest apologies. We just had that little glitch today. But we're happy to go forward now, and we have a number of people that are already in, so it's really, really great to see you. Please open the chat and let us know who you are and where you're from. Make sure that you change it to say everyone and not host and panelists. And I look forward to seeing who's all with us today. Wendy from OHA. I think, Wendy, you're one of our top attendees, so I'm so pleased that you're able to join us again today. I think we have a really, really great opportunity for this discussion. And Sandeep from Closing the Gap, we have over 50 people online now. Andre, Adrienne, Carrie from Temiskaming, welcome to our event today. I am really looking forward to being able to share. Karen from MWT, Roya from Kiwetong, Healing Waters, thank you very much for joining us from the north. Christina from OH West. Jessica, please continue to let us know who you are, and then we can all engage and participate in today's event together. I would like to start with a land acknowledgement. Really wish to acknowledge the land on which the University of Toronto operates, which for thousands of years has been the traditional land of the Huron-Wendat, the Seneca, the Mississaugas of the Credit. And today, still the home to many Indigenous people from across Turtle Island. We're grateful to have the opportunity to work on this land. And I was doing another land acknowledgement yesterday for a conference we were hosting, and came across a very nice painting, and it was called Unity. And the motivation behind this was to think about our home on this native land. So just understanding and appreciating that we are all operating on native territories wherever we might be, coast to coast. I would like to bring us up to a poll and see how many people are I do recognize some names on the online, but how many people might be joining us for a first time today? So if we could bring up the poll, and let's see, have you participated previously, or have you signed up for the first time because the topic of performance management has enticed you to join us for a first event? Let us know. I see people are coming in, and look forward to hearing from everybody. This is a question that we know that everybody can participate in and answer. Great. So reach for that button. And I think, okay, let for a few more people. And I think we have almost everybody now. That's great. So we could share the poll back out, and it looks like we have about a quarter of us are joining us for the first time, but 3/4, 75%, have been with us before. So welcome. Really, really happy to have you with us if it is your first time, and I hope we will inspire you to come back, because this is the kind of work that we do, and we bring it to the OHT audience every month. Today, I just want to say we have a really, really fantastic session lined up for us. I am going to come in a little bit later in the event, but we're going to start off with some data. With VJ is going to present, then some evidence from Jocelyn. Myself and Victor is going to talk about some of the research that he's been doing with OHTs to understand performance measurement and how we might at HSPN best support the OHT. And Kaylee is going to talk a little bit about some of the current capabilities and capacities. Driving this is the fact that we, for people who are with us in the September webinar, know that we had a leadership survey and we talked about some of those results. And one of the areas was that performance management, and the leadership survey indicated variability and some opportunities for improvement in performance management. And at the end of that webinar, we asked the people participating what they would be interested in learning a little bit more about. And the overwhelming topic of choice was performance management. And so we had a few clues, but we've got more information for you now on this topic. So this is a user-driven agenda for us today. We have been producing reports and indicators at HSPN to support performance measurement, which is one element of performance management. And we're going to show some of that. And we studied also how we could improve our performance measurement supports, and that's what Victor will speak to. And we want to come out of this with a bit of a sense of how best to support OHTs wherever you might be in your organization's participants to build capability and capacity for both performance measurement and performance management. And this webinar is a first step towards that goal. I will turn it over to Vijay now to run us through some of the results we had that motivated our focus in this area.
Awesome. Thank you so much, Walter. Hi, everyone. I'm going to spend just a few minutes talking about the results from the HSPN OHT Leadership Survey. So HSPN led an OHT leadership survey earlier this year, and we had 55 of the 58 OHTs participate in this survey. The survey was distributed to first the most involved individual from each member organization in order to provide us with a list of members in the leadership team. And then the survey was distributed to a total of 1,557 individuals in March of 2025. And we had 857 individuals respond. So that gave us an average response rate across the OHTs of 63%. So in our September webinar, as Walter mentioned, we spend a bit of time going through the survey results, but for this webinar, I'm going to focus on just two domains/subdomains as it pertains to our topic here today. So the bar graph here, it shows the OHT level means and average proportion of individuals that selected each category for the shared responsibility domain. So shared responsibility, it really refers to the extent to which partnership or partner organizations, they can collectively commit to improving things like patient care outcomes, and they are able to hold themselves accountable for their performance. We found in the OHT leadership survey that there is relatively a strong sense of shared responsibility with things like measurements and targets for OHT assessment. So there was an overall mean score of 3.74 in this domain. This graph here, it's looking at the breakdown of the three items that make up the shared responsibility domain. So just looking at it in a little bit more detail. And at the item level, you can see the mean scores. They range from 3.68 to 3.86 out of 5. We also found for all of these three items, the between OHT variability, so how differ each OHT is with each other, was quite low. We had a specific item, we have selected measures to assess our progress that had the highest between OHT variability of 0.08. So the bar graph here, this shows, again, the OHT level means and the proportion of individuals that selected each category for the organizational context domain. We found that the organizational context domain had the lowest scores in the survey. It had an overall mean score of 3.11. The organizational context domain, this includes two subdomains. So there is a performance management subdomain and a social context subdomain, which today we're going to be focusing on the former. So for performance management subdomain, it consisted of 7 items, and it really captures elements that promote discipline and stretch. So it includes questions involving monitoring performance against clear expectations, accountability, and encouraging ambition. And this bar graph here, this shows the mean scores and average proportion of individuals which selected each option for the 7 individual items that make up the performance management subdomain. So this domain, as I mentioned, it did score slightly lower. So the individual mean scores ranged from about 2.69 to about 3.49. And similar to the shared responsibility, we found the between OHT variability was fairly low with all of these items, with the item related to issuing creative challenges to organizations within the OHT instead of narrowly defining tasks that had the largest variability with an ICC of 0.09. So I'm just going to pass it on to Walter here to talk about the discussion.
Yeah, great. I'm actually just going to pop it back a slide just for a second.
Yeah.
Just to get a little bit of a sense for people who are online. Like if we have a look at some of these items, I just want to have a sense, like we looked at them and said, some of these are clearly within the OHT mandate, and some of them, I think there's probably still a little bit of challenge for OHTs to feel that they have the capabilities and mandate to do so. So such as, I think OHTs can probably do a good job of issuing creative challenges to organizations within the OHT instead of just narrowly defining tasks. So being that kind of big picture. And we see there that there's still not a lot of OHTs that are being rated self-reflected. I mean, these are reflections about the OHT's capability of being excellent in that space. On the bottom item, which is even less common, rewarding or correcting actions based on rigorous measurement, that's an area where rewarding or correcting actions is still a fairly difficult space, I think, for OHTs to have a mandate to do that. Some people actually think that they are doing excellent, so we're going to be interested to learn more in the future. But I did pop into the chat what people thought they might be trying to do in this space of performance management, which starts off with a little bit of goal setting and then thinking about the feedback and the measurement along the way. So I'll open that up. Vijay and I have also done a number of regional presentations, and we have a little bit more time to kind of locally talk about what's going on and what the results mean. Clearly, we identified that there are opportunities to perform in this space. And even yesterday, Vijay and I were giving a presentation, and there was a physician leader who said, "So what? What does this even matter?" And we would say that if you can't, motivate and monitor what it is that you are trying to accomplish, you can have a really hard time knowing whether you're succeeding or not. What gets measured gets managed in some ways. And while everything that's important may be difficult to measure, it is difficult to move the bar on things that we're not measuring and monitoring and being ambitious about that work. And I think OHTs need to be ambitious. But what can be done to support OHTs to improve? So now what can we do? We've also had this question out there. And a couple of the things that we would say is having a high value, reliable indicator set with equity. And that's something HSPN has been supporting, but also thinking about performance intelligence, measurement, and learning. And then we started to think, well, what else is there besides just providing data? And so we undertook a rapid review of the literature to identify some best practices. And I'm going to turn it over now to Dr. Jocelyn Trowbridge to lead us through some of her findings on a rapid literature review in this space. So Jocelyn, I'll turn it over to you now.
Thank you, Walter. Hello, everyone. My name is Jocelyn. I'm going to be talking a bit about some best practices for performance management, specifically coming from integrated healthcare network research. We wanted to know, what does good performance management look like in an integrated network, specifically healthcare delivery networks? We wanted to conduct a synthesis to understand the best practices. We used an AI-assisted literature review and pulled together a chart that I'm going to show you on the next 2 slides that presents some of the elements of best practice. And we know the importance of performance management because integrated care is very well linked to how partners inside the network set their own shared goals, measure progress, they learn together, and hold themselves accountable. So the next 2 slides present several elements that the literature shows are best practices for performance management. The first one is a shared outcomes framework, co-produced network level performance framework that can define what good looks like for your network, that links structures to measurable outcomes, but also assigns clear ownership and review routines. Some examples of these practices would be to ensure compact domains, such as access or quality and patient experience, as well as population outcomes, cost, staff well-being, and service integration and equity. An example practice is also to have a logic model and theory of change to accompany your outcomes framework to ensure there is ownership per domain chosen and to have a scheduled review practice. The next element is to ensure, as we saw in the previous slides, that the indicator set is very high value and includes equity. And this would mean narrowing and ensuring your indicators are purpose fit, and they capture both your service trajectory integration goals, which would be maybe continuity handoffs and weights, but also your population outcomes, and to ensure they are feasible to collect and share across organizations and are auditable. Some example practices would be collecting indicators around time to first community contact, post-discharge, avoidable ED use, ambulatory care sensitive conditions, patient-reported outcome and experience measures, connected, if possible, to equity indicators such as neighborhood, income, ethnicity, language, etc. The next element is to have the capacity for reliable data plumbing and performance intelligence. So the idea that you have capacity on your team, you have timely and linked data, and you have an analytical function that allows the metrics to be informed, the team to turn into governance and behavior change decisions. Some example practices are to cross your data linkage across your settings, create common definitions and denominators, and ensure there are processes for monthly synthesis briefs for all leads and partners involved. The next element is to ensure you have routinized audit and learning cycles, a regular audit and feedback cycle with benchmarking, rapid cycle tests that are embedded in your joint governance. And key to this is also frontline involvement to drive behavior change. Some of the literature suggests that these could be also trust building exercises with partners and with frontline network members. You have them in monthly performance huddles. You could create comparative dashboards, PDSA cycles that might be tied to your outlier indicators, and documented action logs and follow-up. The next element is behavioral framing and frontline engagement. This is trying to explicitly link the individual behaviors you want to change and the network level goals that you've set in your shared goal framework to support the adoption. And the use of these behavior change frameworks can help in creating checklists with teams, celebrating the bright spots to reinforce desired behaviors, and really creating a team sense of ownership over the behavior change that needs to happen in order to achieve the network goal. The next element is aligned accountability and incentives. This is also to be able to blend your formal oversight with trust building approaches in the network. This involves clarifying roles and expectations, but also consequences and incentives that reward joint results for all partners. Example practices could include public scorecarding, ensuring you have co-owned metrics alongside your mandated indicators, and a staged escalation process which focuses on coaching and peer support before corrective action. And finally, team support and capability, ensuring your team has access to coaching, data literacy, frontline team skill building to be able to act on the signals you're seeing in your performance reports. And this could involve dedicated time for testing changes, establishing communities of practice, and peer learning sessions. Overall, the literature said that avoiding indicator proliferation is going to be really important in managing performance, ensuring your instruments are fit for purpose and are validated, being able to connect dashboards to your decision routines, aligning your incentives to controllable levers, and importantly, not to overemphasize a structural reorganization at the expense of developing a very solid and trusting feedback culture and shared accountability. And this slide is some references if you would like to read a bit more about that. Thank you.
Thanks so much, Jocelyn. So you can see we have some very evidence-based ideas and approaches, and we will help to support OHTs in advancing towards achieving those over the coming years. And I think we're going to see where we can start from. One of the things is before we get into ways we can improve, I just wanted to ensure that the people participating in today's webinar are aware of some of the work that we have been doing. So we've been producing performance results since 2021 for the Ontario Health teams. And we started off with the very, very crude league tables. This is old school style of looking at Ontario Health teams. We had de-identified the teams, so you can't see who is who on this chart. And this is a chart that we had for emergency departments best managed elsewhere. We did have some panels and got a lot of advice on how do we select a limited set of indicators. We had 10 for all OHTs, and then 5 for each of 4 subgroups: older adults, people with mental health conditions, people at the end of life or palliative individuals, and then also diabetes individuals. And so we were fairly focused. We've been doing equity measurement in these areas since the beginning. The color of the dots on these indicators represents the proportion of the OHT's population that lives in a high deprived neighborhood, in the quintile of that relative. So you see actually on ED visits being managed elsewhere, up at the right end, there are darker dots, meaning that those areas with more deprived neighborhoods are having a harder time keeping these numbers down under the provincial average, or just even to lower levels. Some people are going to be above the average because that's how averages work. I'm going to go quickly through some of the others, just so you know that we've been doing these like related to mental health related care. This one being frequent emergency department visits. We had them for people, frail older adults. One of our key indicators there were 2 or more emergency department visits within a year for fall related injuries, sort of being areas to watch out for and how to manage those cases and situations. We had unplanned visits in the last 30 days of life, one of our key end of life and palliative care. So if we can provide better care in the community, we can keep people from needing to visit the hospital. In 2024, we came back out to the Ontario Health teams and we said, okay, that was round 1. What should we do for round 2? And in this exercise, we were able to provide individualized OHTs with slide decks that they could walk right into other meetings instead of just those staggered reports with individualized results, like your OHT's results. And we also provided spreadsheets with data, so you could go out and calculate up to 30 different indicators. We had a small subset that we were producing, but you could go and play, and you could look at it within different population segments according to the primary care models that people had, or the material deprivation that people had. And in selecting the indicators, this is what the report had. The first section was your ranking. So we still did the ranking exercise so people could see where maybe there were opportunities for improvement. And then the second section dove into the individual results for 12 specific indicators stratified by these different subgroupings, some of them being equity and some of them just being about understanding population management. To select the indicators, we actually identified an OHT representative as best suited to answer a survey. We asked the OHTs who would be best suited to answer a survey about our indicators. 56 OHTs were invited, 42 responded, 75% of them. Most of them were either an executive director or an operations or lead for analysis or population health. So we think a good selection. And then we put all the indicators we were putting out to people, and we had them rate them on a scale of 1 to 10. And so we selected then indicators for our next round of reporting based on those that were at least a quarter of the OHTs selected it in the top 2 boxes. These are one of the 2 most important indicators, or at least 40% of the OHTs represented the top 2 for our population specific indicators, where there were, a smaller set, there's only 5. We also asked about how we should do reports. Should we do them, for subsets of indicators only, or should we provide like a mixed report that combined a number of indicators? And by far, that was the preferred option. So we did produce reports with a limited number of indicators representing each of those groups, and that's how we selected them out. We also had comments. Some people still wanted all the detail. People saying, like, could we still have a report for each of those 5 reports? We've expanded our first priority population, and now we'd like to have mental health and addictions and older adults as well. So we want to have those sets of indicators. Just other general comments about the reports being informative and helpful in that regard. And so we're hoping to always kind of ensure we not only provide value in the previous report, but that the next one is even more valuable. And people indicating about the reports providing value over just the data and results. And so that was useful by many. And so this is just a note that guidance on how do people use the other Excel data. And I think we tried to do a little bit of that, but we could probably do some more. At the time, we did not have Ontario Health with their OHT dashboard of indicators. So I think a lot of those kind of detailed results are now a little more readily available through OH. So we have to think about the balance. And this is just people rating the items. So, I'm showing here ED visits best managed elsewhere. It was almost 65% of these people said it was the most important or second most important indicator for that OHT. So you can see that was a natural one for us to conclude, whereas virtual physician encounters was not viewed as being most important by nearly as many people. So this we used as guidance, and we ended up with the top chosen indicators of this whole set here that are listed. So just to say, we've kind of been listening for direction along the ways. And we wanted to know then, we also provided these stratifications, but we really, really wanted to know how these reports were being used and how we could make it better. And that led to a whole research study that we're going to go through next. But I think just before that, we do have a poll. I'm interested in knowing amongst our participants here, how aware, because we're about to talk about how people use the reports, how aware are you of the HSPN performance reports? Like, you didn't know about them, you knew about them, but didn't need those data. You had other sources. You knew about them and need the data, but these reports are not meeting all of the needs. So if we could pop up this poll and leave it there. So let's go ahead here and have people chime in, or whether people are using these. They're getting responses across all of the categories here. So really, help us to understand how we can, also with the flow of today's webinar, how much we need to provide more detail and people's level of awareness. And we are slowing down, but there's still some out there. Okay. All right, let's share out these results, please. And we can see now that about a third of the people here didn't actually know about the performance report. So I'm glad you joined us today. They're available on our website. We can provide some links afterwards. You knew about them, but weren't quite sure about how to use them. And then you know of and are using. There's about a quarter of the people here knowing and using them about them. So that is kind of our baseline, and that gives us a sense of who's participating today. Thanks very much. I'm going to turn it over now to Dr. Victor Rentes to review what we found when we went out and talked to OHTs about the way that they use results.
Thank you very much, Walter. Hello, everyone. My name is Victor. I will be talking about this formative study we've conducted to, like Walter said, understand how well our reports are being used by OHTs, and how importantly, how we can improve the way we design and deliver these reports. So first I'll begin describing this overall learning cycle that we are aiming to foster with our reports. So up top on the left, we collect data, we analyze different administrative databases. We create these reports with performance indicators and benchmarking across the quadruple aim with focus on equity. We distribute reports along with data sets. We provide webinars and facilitation sessions with individual OHTs to explain how the reports have been constructed and how to use them. And then there's the intended use. So we hope that OHTs will review the reports, identify gaps, prioritize, and plan for improvements, implement care delivery improvements and system integration. And that will translate to health outcomes, which improved health outcomes, and hopefully that will be measured in the subsequent evaluation cycle, and then you close that loop of performance measurement. So in this formative study that I will be discussing, we aim to explore this knowledge gap. Are OHTs using our reports effectively, and what are the key barriers and opportunities for improvement in how the reports are being designed and delivered? So for this, we use an audit feedback framework to guide this study. And you may have heard of audit and feedback as a quality improvement strategy in which health professionals are provided with quantitative summaries of their clinical performance when treating specific groups of patients. Typically, audit and feedback is delivered at the provider level, but we are considering our role in providing audit and feedback to individual OHTs. Right, and then in doing so, we are looking at the entire process of selecting the clinical topics on which to improve, collecting and analyzing population level data, producing and delivering quantitative summaries of clinical performance, and making the subsequent changes to clinical practice. So this is an exercise in performance measurement and then performance management, the way we change clinical practice to improve performance. And so other names for audit and feedback within the literature, things that are related to audit and feedback, clinical performance feedback, performance measurement, quality improvement, key performance indicators. These are all terms that ultimately go to the core of performance measurement for performance improvement. And so in doing this study, we reviewed some of the audit and feedback best practices to understand whether or not we, HSPN, are adhering to these best practices and how can we improve the way we deliver audit and feedback to individual OHTs so we can continuously improve how well we measure performance. So, nature of the data available for feedback, we want to make sure we provide multiple instances of feedback, provide feedback as soon as possible and frequently, provide individual rather than general data. So at that OHT level, and then choose comparators that reinforce the desired behavior. And when it comes to feedback display, importantly, we want to link the visual display and the summary message. We want to provide feedback in more than one way. We want to minimize cognitive load. And then in delivering the feedback intervention, we want to address barriers to feedback use. We want to provide short, actionable messages with optional detail, address credibility of information, prevent defensive reactions, construct feedback through social interaction. I'm going through the list here of best practices that guided this study. So the nature of desired action, again, so we want to make sure that we recommend actions that are consistent with established goals and priorities. We want to recommend actions that can improve and importantly are under the recipient's control, and recommend specific actions. So this list of best practices sort of guided our thinking in how we wanted to assess our own performance, if you will, in delivering feedback to OHTs. How well are we delivering feedback to OHTs? So for this study, we selected 6 different OHTs, purpose of sampling with 3 broad categories of low, intermediate, and high capacity in terms of report utilization. So this was based on perceived capabilities to use indicator reports. So here at HS, we assessed the different OHTs in terms of OHTs capacities or capabilities to use the reports, and these were done after our facilitation sessions. So we wanted variability across that capability continuum. So we wanted feedback. We want to collect input from early stage OHTs that were still in the beginning stages of being able to use the reports, and more advanced OHTs with high capacity to interpret reports, right? And so we sample in that fashion, and then we also targeted 3 different key representatives from each OHT, so executive director level, implementation or working group lead, and the data analyst and evaluation lead. So we wanted input from those 3 different roles on how the reports were constructed and used. So this graph just presents visually the 6 OHTs across this continuum based on our internal assessment, so that we can get variability in that sense from the 3 different roles. This following graph shows the list of participants in our study. There were 18 people who were interviewed. You can see the different role descriptions, but they have their equivalent in the 3 different role types that we aimed for: that executive director, implementation lead, and the data analyst, evaluation lead. So for interview data collection analysis, our questions basically pertain to how reports are being used and what are the main utilization barriers within OHT. So things like to what extent does your OHT make use of indicator reports? And then we explored so who uses the reports, for what purposes, what are the most useful indicators and why, what are the least and why, least useful and why, main factors that hinder your ability to translate insights into action, and then suggestions on how to improve our reporting activities and products, right? And so these interviews were conducted approximately 6 months after after we distributed reports to OHTs. So our framework for thematic analysis, I'll briefly explain this figure. So we use a framework called the Clinical Performance Feedback Intervention Theory, the CP-FIT framework. And this framework basically says that in order to foster learning cycles of data-driven learning and improvement, you might have seen that the data to knowledge, knowledge to practice, practice to data figure from learning health systems literature. In order to foster these learning cycles, you need alignment across these 3 key constructs. So we need good reports, so feedback variables. We need indicator selections, indicators that are well aligned, adequate data collection and analysis methods, feedback display, feedback delivery, and we need the recipients of those reports to have expertise and have appropriate behavioral response towards that feedback, and we need well-aligned contextual factors. So the way OHTs organize work, right, and implement performance management, really. So if we have those three key variables, when aligned, they will influence these learning cycles. And so we guided the analysis of our interview transcripts using this framework, and we coded interview comments and then the topics that emerged from the interviews across these 3 different domains and their subdomains. So this graph shows the high-level results of our coding from the interviews. We basically went through all interview transcripts and coded what people said against these 3 different domains, and also whether people spoke negatively about barriers, so opportunities for improvement in the way the feedback is designed, the recipient characteristics and the contextual characteristics, whether they were providing insights, so suggestions or change ideas, or positive comments, things that are working well. Right, and so you can clearly see that feedback, the characteristics of the report and characteristics of the OHTs were the most salient points that emerged from the interviews, which prompts up to which leads us to conclude that in order to improve performance management, we need to focus both on the way the reports are designed, and we need accessible report design, and we need to build organizational workforce capacity for data-driven improvement, right? So this came from this is one insight from this study. So I will provide a detailed analysis of a more granular analysis of the feedback components and elements that came out of this study, and so details around like what specific input we received that suggest key opportunities for improvement in how the feedback or the reports are designed and delivered to OHTs. So again, using the CP-FIT framework, the feedback construct is divided in these 4 different domains: indicator selection, data collection analysis, and methods. Data collection analysis methods, so the way the feedback is displayed and how it's delivered. And each one of these domains has their own subdomains. And again, we coded all interview constructs across these granular subdomains using the CP-FIT framework. But before I go into our findings, I'll introduce this poll. Very curious to know from this audience, so that we can compare your input from what emerged from the interviews. So to you, what are the key opportunities for improvement in how HSPN designs and delivers our performance indicators to OHTs? And please select all that apply. So are the key opportunities for improvement or areas that need to improve the most? For those of you that are familiar with our performance indicator reports, and the previous poll showed that we have some work to do in terms of disseminating our report and increasing that share of people that are familiar with the report and use the report. But for those of you that are familiar, what areas need to improve the most? Is it indicator selection? Is it data collection analysis methods, how we collect and analyze the data? Is it the way we display the data visualizations, or is it the delivery modalities in terms of having you report and then the facilitation sessions and webinars and sharing the Excel spreadsheets? So I will give you a moment to complete this poll. Okay, I'll ask. Okay, so I think we should be closing in now on the answers. Can we see the poll results? Okay, so I see that 73% of you said that the delivery modality is the key opportunities for improvement. Please, if you have additional comments, please add those in the comments section. We would love to hear, as Walter has said, we would love to have further feedback on how we can improve that delivery modality. I see that 45% said to display the data visualizations, 23% data collection analysis methods, and 14% indicator selection. So it seems like we're selecting the right indicators. Our data collection analysis methods seem to be adequate, and I think that the delivery modality and display are the things we could tweak and improve for future evaluation cycles, and we are exploring different ways of how to do this. Okay, so as others chime in the chat, I will move forward and show the results from our interview study. So in this graph, you can see the percentage of the comments pertaining to each one of these subdomains within the feedback variable. So indicator selection, data collection analysis, feedback display, and delivery. And if you consider the negative and insight options, I highlighted 3 key subdomains here that represent opportunities for improvement for us, HSPN, based on the number of comments or the percentage of comments relating to negative or insight. So accuracy, specificity, usability are things that we should be focusing on based on our study. And I'll bring some quotes that emerged from the interview. So in data collection analysis methods, so accuracy, the extent to which reports use data believed by recipients to be true representation of clinical performance. We saw that a negative comment from a executive director. So they said that the first thing that happens when you show data is everyone says the data is wrong. If I go and talk to our primary care around continuity of care, you get a lot of questions about where this is coming from, how did you figure this out, and so forth. And so we at HSPN, we need to be aware that the challenges around that resistance to data can occur from different partners, and that's just something we need to be aware of and try to mitigate as much as possible in how we deliver data, so that accuracy is perceived to be high as much as possible. So that's just something we need to be aware as we deliver our reports. And another comment around usability, so the extent to which reports employ user-friendly design. So a negative comment that a person, the strategic initiative specialist from OHT1, they said the frontline providers enacting change on the ground want to be able to see something visually quickly and know, are we red, green, or yellow? Like that kind of stuff, because they're moving on to actually doing the work. And so as much as possible, delivering indicators that or visualizations that are easy to interpret, red, green, or yellow, and so that people can prioritize quickly and move on to doing the work, And so I brought a graph from our report here. This is the rate of ED visits best managed elsewhere by material deprivation quintile. You can see the 5 different quintiles in the performance for this specific OHT across these different quintiles in this indicator. And I'll bring a comment that came up from the interviews around this. So the project manager from OHT5 says, I'm struggling with the Q1 through Q5 a little bit. There's no clear definition of the 5 quintiles. And we provide a definition on slide 17, but the definitions are not here. And people, one thing that emerged from the interviews is the need for self-contained slides that can be easily shared. And that might include, the definitions and also interpretation instructions or things that make it easy for people to interpret. So they said you have to match that to that proportion, to that definitions chart. And then they say, I'm still not even positive I have my head around it. I think this is way too complex. So this is just to highlight that we need to focus on reducing complexity of some of these slides. I brought a spider diagram, which is another visualization that we have on the reports. And this in this diagram, the closer you are to the middle, to the center, the better. The closer you are to the highest ranking OHTs, this shows your relative performance and what percentile you're in. So the closer you are to the edge, the worse for each one of these. And a simple idea that came up from these interviews is for us to highlight the indicators that are in which this OHT is not performing very well, right? So these are the 3 indicators that are closest to the edge, and these are the indicators closest to the center where they're doing a little bit better. And so this type of simple addition to our graphs can support interpretation and facilitate the use of these graphs. And so I'll summarize some of the recommendations that came out of this study. In terms of designing and distributing the reports, HSPN, we need to focus on shortening our reports and reducing complexity of data visualization. So things like green, yellow, red facilitate the use of reports and minimize the cognitive load. We know that competing priorities within OHTs can be overwhelming and reduce the capacity to analyze and interpret results. And so we also want to address data credibility challenges and source reconciliation, provide, like I said, self-contained slides that are easily shared across different committees. Providing a summary page with most important findings and indicators available at a glance to pique user interest at the beginning of the report was emerged as a good idea, as a good practice for us to think about, and continue to provide and improve the webinars and facilitation sessions to help with data interpretation. Those were perceived to be valuable. Finally, some recommendations pertaining to the context and the recipient. I didn't go into the results of these in the presentation, but we did analyze what people talked about in terms of the OHT. So highlighting success cases of local initiatives and best practices and performance indicators from the high-performing OHTs can be an effective way of helping especially early-stage OHTs. So things like strategic engagement with partners and communities and the work of that operations backbone team was highlighted as something very important to enable performance management and measurement. And then continue to promote and facilitate effective use of external change agents. So impact fellows, RISE coaches, and consultants were perceived to be valuable. Prioritize infrastructure development challenges. So performance and data management frameworks, best practices in patient engagement and equity analysis, and then training mechanisms on data utilization, data action planning, and implementation knowledge translation to those recipients. So the reports can be an effective way of enhancing OHT's ability to use reports. So these are the findings that came out of the study. So I'll pass it back to you. I'll pass it back to Dr. Kaylee McKellar now. Thank you.
Hi, everyone. Thanks, Victor. Really great to see the results, and it's nice as evaluators to evaluate our own work and know how to do better. And I appreciate too some of the comments in the chats about how people have been using the report or how it can improve, and that's always great too. We're going to turn it back to OHTs again, and sort of bookend this and sort of looking at OHTs, performance capacity, etc. And then have some conversation from there. So I'm just going to share a little bit about what I've heard from the community of practice in terms of what some of the resources are. So in order to do some of these pieces, sort of use the data that we've provided as well as the other sources, and do some of the best practices that Jocelyn was talking about, you need to have some resources. So this figure shows the approximate level of resourcing for analytical work. So that's one piece in this sort of the plumbing of performance management. But really, these people are the ones that are able to kind of get some of the answers to some of the questions for data and work with data in terms of performance measurement, but also in terms of informing different programs. So you can see that about 60% of OHTs who responded to this have less than 0.75 of an analyst working with them. Some of them do, but 16% have more than one FTE analyst working. So again, there's a lot of variability across OHTs in terms of the resources to do that work, and it's something that's to take into consideration as well. On the next slide is just some information about how people are structuring it. So the structure of this is less important to actually having the resource, but it is interesting in sort of the resource constrained environment, how people are working with this, particularly if we have less than a full FTE, right? So most analysts are shared employment with another health service provider or another organization, and that is sort of the most common structure. Also, many are employees of OHTs, and there are also some unique approaches. So having one analyst that's shared with multiple OHTs. So this is different ways that people are sort of working to get this capacity for their own team. On the next slide, I want to share about the self-rated individual capacity. So this isn't for the OHTs, but about individuals having this capacity. And we have two pieces here. One is logic model. So have you created a logic model? And you can see there in the orange that the most common answer is yes, I've created logic models independently. So a lot of people do have that ability. And even some are in the teaching space of showing others how to do it. But we still have a lot that aren't sure what they are or don't have much experience. And I bring up these logic model, and this connects to what Jocelyn was talking about having a sort of shared framework. And the logic model is one tool to get us to that place of understanding what commonly success looks like, etc. So again, something that is an area for improvement. And there are some HSPN resources for this as well if you happen to be in the no, I don't understand or want some practice. The next piece is how comfortable are you selecting indicators? So again, this is about having high value indicators locally, and whether you can sort of build off that framework of that logic model and select appropriate indicators. And here the general capacity shifts a little bit to the left, so a bit lower. And the more common response here is moderately comfortable. I can do it with some support. So that and less is more common. So this is a potential area of support that is needed by OHTs. But again, lots of variability, and there are some that are very comfortable doing this work, which is nice to see. And finally, the question about sort of self-rated team capability to interpret and apply data. So moving away from sort of that analytical piece and performance measurement, but knowing what to do with that. So overall, the self-rated team capability is pretty high, with sort of we have some room for improvement being the more common response. 30% are confident in their capacity, which is great. And again, 50% have some room for improvement, and 22 have a lot of room for improvement or have no capability there. So I think it's nice that we have that there, and as always, it's something that we can improve on. And I did want to turn it over to kind of build a poll from that and get a sense from the audience, sort of what are the key opportunities here for improving the improvement in interpreting and applying data. So here are some of the pieces that connect a little bit to the best practices that Jocelyn stated, and Myron, you can launch the poll. And by all means, there are some potential others as well, but we have access to meaningful data, having indicators that all or most network partners see themselves in, clear ownership of metrics, and that can also be sort of a shared ownership that Jocelyn spoke about as well. having frontline involvement in the interpretation and behavior change options for those indicators, embedding performance metrics in your strategic plan, having a performance management committee embedded in the governance structure, or you might call it by a different name as well. And then sort of also the piece of sort of understanding possibilities to drive change, so really knowing what the sort of change ideas are, building off of the metrics in your measurement. I cannot see whether people are responding or not, so I'll leave it up to Myron to sort of see if we're.
People are responding. I can
Okay.
see that, Kaylee,
Okay.
and just let you know we have there are a lot of options. I encourage people to scroll down with the 7 options and check any and all that apply. So because people can check more, we're going to give it a minute, I think, to enable people to go through and, remember, people, this is a poll. This is not a test. So you can just click off the boxes that you think are applicable. And but I think a lot of the boxes are pretty popular, Kaylee. I'll tell you that.
Yeah.
It's I don't see any loser. There are relative winners. It looks like a little bit of a very close horse race. It's like going through the entire batting lineup over and over and over again.
But yeah, no, they were talking spelling.
Okay, why don't we share these back out and then people can all have a look. And can you see that, Kaylee, now, the actual result?
Great. Yeah. So as you described, it looks like it's pretty equal across the board. Understanding possible actions to drive change, and having indicators that all our most network partners see themselves in look like the sort of highest scoring in terms of the most or more people selected them as an area for more room for improvement. And looks like the best performer, least selected, is clear ownership of metrics. So interesting to see, and I guess this does show that these are where the room for improvement is, and something that we can sort of work towards. On the next slide, I actually wanted to have a little bit of a discussion from that. So I think there's probably also people who kind of have internal practices that are working well, but also given these sort of areas of support that we highlighted and what we've heard today, I'm wondering if people could respond in the chat, what forms of support, over and above the reports that we provide or the data available through Ontario Health would be useful to you, and really good to get these sort of suggestions. So please do pop them in the chat.
So
yeah,
and we can go from there.
I think the people joining us today are the people who are interested in doing this. So I think this is a really good candidate group of participants to help think about this, work on this. Andre, who's been online and chatted, and has been one of our more active participants today, but I don't know how representative he is of other people's. I know Andre's a user of our reports and has expressed so, and is also quite data savvy. In that, so it could be that other people are find the reports to be intimidating, or it is interesting, to note that result, Kaylee, around the indicators that are most salient to the partners within the OHTs, and I think Ontario Health has mandates about what they are hoping that OHTs will do, and I believe that in the directions they want OHTs to move in action, and most of the indicators that are being produced and supported that way enable OHTs to monitor how well they're doing on those. And I think there's going to be a tension, and we've noticed a tension between the priorities of Ontario Health and the priorities of the OHT, and I think executive directors and people managing performance data face that tension, and so that's one that I think that's very, 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 very useful. I hope everybody's keyboard is working still, because I don't see a lot of answers. It could be that there's but others are. So one of the things that we are looking to do more of, and today's entire webinar is a first step in that direction, which is when we produce data, what should some recommended practices be for OHTs to advance on these priorities. So we have our leadership survey, and which is our most recent data product, which produces, I think, meaningful results about how OHTs are advancing. And we had some areas for opportunities for improvement, and this webinar is based around that idea of how we can support OHTs to do better at performance management. And I think there would be similar approaches to supporting OHTs on which opportunities they should be, what some change ideas might be. And I think in some of the areas, there's evidence synthesis available from sometimes, related to collaborative quality improvement plans. Ontario Health does produce change ideas, and we can point people to those resources. For other elements, the Master Health Forum has a health evidence unit, and they have produced a number of evidence syntheses. So I think the first place to look is where we have existing evidence syntheses, and then where we don't, then finding ways to, prioritize and provide some change ideas. I don't know, Kaylee, if you have any closing thoughts, but it looks like we've kind of saturated the participants today with information that they were interested in learning about. And they don't have more feedback for us at this time, I don't think. So maybe we'll have any final comments, and then we might opportune people to have a little bit of extra time to either move on to their afternoon or go back and eat their lunch. Was everything good?
Yeah, I think that looks good. It's good to hear some of the feedback so far, and there's lots of resources too that we can share from HSPN as well after the fact.
We run this webinar for those people who are new. Many people actually had this in their calendars. They must have, because notice on this month's webinar went out a little late. We did a little bit of a gear shift. We were going to cover equity this month. Equity, we're going to talk about equity performance management in January. You might say, we'll run a monthly webinar. Why is it in January? Well, December is a holiday for most on the fourth Tuesday of the month. And I have heard that on November, the fourth Tuesday of November, there is already a substantial provincial Ontario Health Team event happening. We will actually be there running a workshop on performance reporting and performance management. Now that you've been to this, you might come for more of a work group action-oriented workshop if you're attending that, and if not, you've been here today, and most of the content to drive that activity we've talked about here today. So we're going to be turning it a little bit more to action-oriented work within the context of that workshop. So we will not have a webinar in November in order for us to be running a workshop at this time at the in-person OHT conference. And we will see you in January. This webinar and the slides will be posted within a week, and we will let you know when that is true. And we also have other reports coming out, and you'll continue to hear from us via emails as those are released in the coming weeks. But we have quite a bit of material that are going to be coming out, even though we're not having an online presence in the short term. Thank you to our team for putting these materials together. There's been quite a band of materials right back from what we did in 2021 to the latest evidence on how to do performance management and reporting. So great thanks to all of our presenters today. And in the background, I know that we have Sylvia and Myron, and I believe Lala is also online supporting the webinar today. So thanks for everybody. Participation and engagement. Have yourselves a lovely afternoon.